Halcyon will cost you about 22 crores with warranty of 5 years. This machine will cost you 10 crores and there is no custom duty. I'm not saying this is the perfect machine. There is a lot of improvement, but we have tried with other public sector undertaking like BHEL, Cell, NTPC, but everybody has failed. People say, why should I do it? But at least BRC has helped up to 200 crores to this organization so that it has been able to deliver this product. So this is a good step, but all of us need, why I am telling in this crowd is because majority are radiation oncologists. Same thing has to happen in medical and surgical oncology also. Robots has to become cheaper. Chemotherapy drugs have to happen cheaper. But radiotherapy, nuclear medicine, radiodiagnosis, they being the basic departments where you have to invest initially. Unless they are less expensive, our student will keep on going to change their specialty from radiation to medical oncology. There's a lot of, court cases are going on. So I urge all of us that all of us take steps in this direction and see that definitely this outflow of radiation oncology to other specialties is reduced. Thank you very much.
Thank you, sir, for your inspiring words and for gracing the occasion with your presence. Now I would like to request Professor Dr. Ashutosh Biswas, Executive Director of AIIMS Bhubaneswar, to say a few words.
Respected Professor G.K. Roth, whom I know more than 30 years in AIIMS Delhi, is a global expert in this field. I think no introduction is required for him to say something about him. And the other dignitaries, Dr. Professor S.N. Senapati, the President of the Society of Radiation Oncology, Dr. D.K. Porida, HOD, Radiation Oncology of the AIIMS Bhubaneswar, Dr. Das Mojumdar from the AIIMS Radiation Department and other dignitaries, special all the experts sitting here of the dash. It's today a great honor for me to be here today in front of you. It's a very important, I think the cancer and the update is a very challenging. Professor Roth has already told that some countries are having #1 cause of death due to cancer. Is definitely the incidence of cancer is increasing. And if you look back the 50 years, it was not there much, but yes, is a threatening, is a challenging for each and every country that facing this, the cancer. We have been doing a lot of, this is the update, to look the back and then forth, because there are a lot of advances coming in various fields, like the staging, molecular technique for this diagnosis, and the therapeutics, the radiation, different advancement has come up in this field, and the chemotherapy, immunotherapy, and so on. So this is the vast area now look into. But exactly what is really very much challenging, the incidents coming up. Everybody we are agreeing that yes, is really engulfing almost all deaths that going fast. So what are the risk factors? That is what we want to really go for it. Is that the cancer has no answer? We cannot do anything for this. After detection, yes, really it is challenging for the doctors to. Now I think there are many areas to explore. There are a lot of gaps in this, the cancer field. Why these people are coming and then they are dying due to lack of maybe the responsibilities of the community, that this cancer nature is that they come very late, and therefore the prognosis, the lifespan is reduced due to whatever maybe 5 years survival or. There are many issues like that we know in the field of this medicine. The can you prevent the incidence? We have done many things, many programs. The smoking is one, the tobacco chewing, there are many community-based. So why these people are, when the people are coming to you, the doctors, then probably it is very late. Can you diagnose, or what program, what robust this program that we are really implementing in the society to detect early of what the nature kind of the cancer that. I think that is the answer for this. If you could detect very at the earliest stage, then probably we can do many things. The patient could be cured 100%. So what is the program? Cancer detection. Usually people, they don't come unless they are very much advanced stage. The cancer most of the time, you may not have a pain. So the cancer nature is that to neutralize the pain, to grow and to not to know. So at the last stage, you feel pain and then you go to doctor, and by the time it's very much advanced. So what are the ways that you really detect? So can you reach to the community to detect cancer? That is now one very important thing. The patient should not come. We have to go to the community. What program that we have? Recently in AIMS Bhubaneswar, we had adopted a policy and a proposal, a program to reach out to the community for screening cancer. We will be having a van, cancer detection screening van, well equipped with the mammography machine and cervical, to detect cervical cancer there, and various other. The van will be well equipped to go to the community to detect cancer screening. Probably that way we are heading now. Bhubaneswar recently I have taken up that post. Another way we are trying to identify, to implement the artificial intelligence in the field of cancer. So we are going to have a MOU with the different universities across the world to help the use of artificial intelligence in terms of detection, and then probably the CT scan sometimes giving not very accurate result, and implementing this AI will be helping you to know accuracy of this. The histopath is a very important. So putting the AI into this, you are going to get a very accurate result about this. The molecular technique and all probably is now not possible in various hospitals. So now these are all the areas that we have to look, strengthen in the field of cancer, starting from the, for preventing the incidence or maybe early detection. I think prevention is a very important. We are not sure which risk factor really to neutralize to prevent the cancer, or maybe reduce the incidence in various cancers, starting from the top, the breast cancer, pulmonary cancer, cervical cancer, colon cancer. There are various other 4 or 5 cancers in the top field. So what risk factor really we have identified? Maybe a lifestyle that we are looking for, that is important cause for. Another thing I was looking in a very negative way, if your lifespan increases, the incidence of cancer increases. So is it that we should not live longer for the risk of cancer, having cancer? That is not good also. But yes, I think aging, we cannot neutralize that part. Aging is a process which inhibiting, that's a risk factor. So there are various areas that, but if the patient coming to us, so I think this is the update to treat how there are many advanced technology coming up. You are sitting all the expert here to look for and to give the support to the patient, the poor patient, and there are several, I think is a very expensive radiotherapy, chemotherapy, all. The poor people, they cannot afford unless they are supported by the government or any kind of policy. So it's a very difficult proposition for poor people having cancer. A support has to be there. And there are various hospitals, although they are supporting and providing the cancer treatment in a various way without any funding from the government or anything. There's society, a lot of society is there. So thank you all the experts sitting here. Thank you the organizing members and the